Okay, good afternoon once again. We shall be having a recorded session for our colleagues who are not here, as well as for your future reference. So today, I'm referring to the notes that you already have for concept writing, as well as overview research processes. It is going to be a brief one, but it requires some bit of attention if we are to achieve our main objective of this semester, that is coming up with our proposal. Yeah. So research processes, we have hinted about this before. Every time you hear about a process, meaning that there are procedures, there are steps that you have to go through for you to achieve the outcome. So when we talk about a research process, we are basically looking at the various series of actions that you need to effectively carry out your research and the desired sequencing of these steps. So you realize that a research without direction, it may actually make you take a very wrong route. So meaning that there has to be systematic procedures that you have to follow if you are to achieve something good. So slide number 3 has some learning objectives where we are expecting members to at least get to know the phases that are found in a research process. Then also, by the end of this very lecture, everyone at least should have an idea of what a concept paper is. Yeah, because before you go for the research proposal, you need to know how to formulate a what? Concept paper. The same way, if you want to come up with a research report, you must have done a research what? Proposal. So actually, each one is dependent on the other. So we shall not like repeat. Once we formulated our research concept paper, then we shall just add on to have a proposal. Then in a report what changes is majorly the tense, because a concept, you are introducing an idea. Then when it comes to a proposal, you are selling your idea. If they buy the idea, then you go ahead and implement. After implementing, then you can report. Meaning that in a proposal, you were trying to convince it will be doing this. The system will be able to do this. But then in a report, when the system is already in place, you are reporting, you are using past tense of the report. Then we shall also have to describe the different contents found in a standard concept paper, be able to identify research problems in their environments, and then come up with good concept papers in regards to these problems. If the team agrees, I'm using the word condition if, we can even make this to be our first word, like the test. Like we don't come and sit, but rather we can do it in the form of formulating what? Concept paper. Because the truth is we need it. We need the concept paper, then we shall come up with a proposal. Then the research report will be done, of course, in a third year when you are doing your final year what? Projects. Then we shall, of course, also describe the steps involved in designing the research plan. When you look at slide number 4, are you projecting? Let me share with you what you should project. Those who are online, give us a second, then we can be able to. So I was telling you that slide number 4 has the research process, which some we have done before. In the phase 1, where you have to formulate the research problem, and then you review your literature, but the literature should be only those publications that are related to your problem that you're trying to investigate about, as well as the solution that you're proposing. Like the only literature you're supposed to review should be in line with what you are trying to solve, as well as what you're trying to do, what to propose, meaning that it should contain the problem domain as well as the solution domain. Then determine appropriate research methodology, how you want to approach it. During your final year project, I understand some people will go for mobile apps, some will go for web apps, some may decide to go for maybe models, depending. So you realize that some individuals will decide to use maybe plain Java, some will go for maybe talk about frameworks, depending. So you determine the appropriate research method or methodology you're going to use, then you can formulate a work plan. In phase 2, you have to conduct an extensive literature study, elaborate your research design, and that is when now we go to formulate a proposal. In phase 1, that is the output of phase 1 is the concept paper. Then in phase 2, it's the proposal. And then obviously at the end, we have to now work on issues to do with the data collection, meaning that we are not going to do actually data collection here. And then you analyze and interpret your data, define some specifications until you now come up with what? A report. Formulating a research problem, we have talked about this before. And this involves composing or defining the following: the background of the research problem, and if, for example, you are trying to solve the problem of traffic around maybe cities in Uganda, then you have to indicate how this problem has evolved. When did it start? How is it affecting people? Where it is? Because when you talk about maybe traffic, not all places of Uganda maybe have what? Have traffic. So when you talk about problem statement, this is when now you state the problem. Yeah, problem statement is just all about stating the problem. Then you come up with the research questions and objectives, the scope. All these ones are going to be elaborated. And then the research justification. Justification means you're trying to prove that indeed your research was relevant. It was necessary for you to conduct that particular what? Research. So you're trying to justify. How to conduct the research background. A background identifies or describes the history and nature of aspects of interests with reference to existing literature. You talk about how this problem has evolved. and you link it to the current situation. Because sometimes, yes, you might be talking about traffic, but maybe when it was a previous problem, it is no longer what? Affecting people. But at the moment, that is why I say you should use latest what? Literature to avoid solving something that was already what? Solved. So it should indicate the origin of the problem being studied, the magnitude or the scope, how it affects the users or the people within that particular area, organization, and so on. Then the extent to which previous studies have successfully investigated the problem, meaning that now you're going to indicate how various researchers attempted to solve a similar what? Problem. You can say maybe, some traffic lights were what? Were introduced that tries to control this and that. But now, given the fact that now for you are trying to bring in new technology that is better than the existing traffic lights, then you can build on that. Then, and the existing research gap. Yes, now the research gap is the problem. Yeah, whereby the existing maybe traffic lights, cannot detect the amount of maybe vehicles from one route to the other, and they end up, having only predefined number of means for each and every route, which does not solve the existing traffic flow within the city. Next, and the escape. Just go back to normal view on the next slide. Next slide is an example of a background, like after confirming that this should indicate the problem you are trying to do what? To investigate about. Then it also talks about, I don't know where you can put it for proper viewing. Can you maybe put it in Word or somewhere else? No, no, no. Just go back. Don't play it. Yes, just use the normal view. And then, if possible, you would copy this. I don't know how we can. Okay. Not this one. This is the problem statement. Yes. No. Go back. No, the next one. That one. Okay. Can you read for us, maybe? Because I know people don't have that, but maybe you read it for us. Okay. I want you to listen carefully. Then maybe from that, you can tell us what the existing problem is, the scope, how it has affected, as well as the previous studies on the same. You just read for us.
patient satisfaction, and access to medical services. One such solution is the use of treatment appointment systems, which enable patients to schedule visits in advance, reducing waiting time and improving coordination between patients.
Okay.
Healthcare providers.
First, go back to the previous. Okay. Like repeat. Sorry. Repeat.
Healthcare service delivery has increasingly adopted solutions for efficiency, patient satisfaction, and access to medical services.
Yes, a moment. Now, by starting like that, you are trying to trigger the attention of your readers that there is a need for what? For digital what? Solutions. In which area? The healthcare, right? For reason being that they improve efficiency, patient satisfaction, and access to what? Medical services. So meaning that indeed, maybe this is a good area to do what? To investigate about, because of the good things that comes with digital what? Solutions in that area. Continue.
One such solution is the use of treatment appointment systems.
Okay, now you realize that now is trying to narrow the scope from digital solutions, now focusing on what? Treatment appointments what? Systems. Very good. Which enable patients to, they mention some of the advantages that comes with such what? Solutions. Very good. Continue.
Which enable patients to schedule visits that fast, reducing waiting time and improving coordination between patients and healthcare providers. Studies indicate that appointment systems play a significant role in minimizing congestion, improving time management, and enhancing the overall quality of healthcare service.
Thank you. Now that implies you are not the first person to do this. There are quite a number of other researchers that have already contributed in that line of what? Yes. Meaning that, okay, that kind of citation you are seeing, in the first paragraph indicates there is a publication that was made by Gutta and Denton, 2008. Then another one by Zhao and others. I told you et al. Means what? And others, 2011. Meaning that those two publications are all in support of the statement that the author has done what? Has written. Does it make some little sense? It may not be much, but even if it is little, let us continue.
At Jose Hospital, however, patients continue to experience challenges finding availability of healthcare services. Many patients travel long distances.
A moment. At Nkozi Hospital, however, patients are still going through maybe such what? Challenges. Meaning that now you are trying to now narrow, or actually bring your scope, the geographical scope, to your case study, which is going to be Nkozi Hospital. Yeah, that is your case what? Your case study. All your research is going to be centered at that. So you are now emphasizing that people are still continuing to, not people, but patients, to have such what? Challenges, despite the availability of healthcare what? Services. Continue.
Patients travel long distances to access treatment, but often return without receiving care due to the unavailability of doctors. In addition, the hospital frequently experiences high levels of congestion, the global waiting hours, patient satisfaction.
Yeah. So meaning that, okay, people come, they bounce. The doctors are not there. So people become frustrated. There is less customer satisfaction. So yet we have already seen in our first paragraph that digital solutions always come with such benefits, increasing and improving customer satisfaction and so on. So now we are trying to show that these challenges are still going on where at our case study. Continue.
Inefficiencies in patient flow and scheduling have been identified as common problems in healthcare facilities, especially in developing countries. Brackets, World Health Organization.
Okay, now, yes, World Health Organization is emphasizing that, yes, indeed, when it comes to developing countries, such challenges are common in health what? Facilities, of which even now your research is going to be conducted in a developing country, meaning that now you're coming up with varied research. Proceed.
Previous studies on hospital appointment system.
Okay, yes, now you see that now you bring in the, like what other people have done what? Have contributed towards improving healthcare what? Services. Then you mention what they have done and what has been achieved. Let us go back to our slides. Okay. Guiding questions while writing or composing the research background. When you're coming up with your research background, you need to ask yourself, what are the processes or activities that take place in the organization that you have chosen? Because now in a case, for example, the case study in question, which is in Nkozi Hospital, they have their own procedures on how to book appointments. Then you have to understand that. How do they book appointment if they are to see doctors? Then who are the actors involved in the organization? Meaning that now your system should capture not everyone within Nkozi Hospital, but when it comes to appointments booking, who should be the users of your system? Meaning that maybe you're going to provide a section or a role for patient, then a role for doctor. In case maybe there is another person, then you can also do what? Do the same. Then which tools and technologies do actors use to execute activities? Which tools and technologies used by maybe patients for Nkozi Hospital if they have booked what? Appointments. Someone can say, sometimes we make calls. Sometimes we just actually walk in and then ask if doctors are available or not. So, and then you will start asking yourself, is there a problem with the processes actors are executing? Are there challenges when someone just walks in without maybe first making a call or booking appointment? Yes, indeed. So now this helps you to do what? Now to formulate your research background. The way actors or the users are executing the process, the tools and technologies they use, give the course units you have undertaken and the emerging ICTs, what is relevant to the problem, what is the relevance of the what? Of the possible solutions to the problem you have identified. Then that is about the research what? Background. That is how you should formulate your what? Your research background. But you realize that it has a very big connection to the problem. Meaning that if you don't have a problem, then you cannot do anything called what? Research. Problem should be first. So let's go to the problem statement. Now, the problem statement is a clear definition that indicates the research gap that has been identified in that particular organization. If we all agree that maybe, okay, our case study is maybe for the hospital, now we need to clearly define what gap the patients are experiencing at that particular moment. So it points either to problematic occurrences, observed events that are puzzling in terms of what? Recent published research ideas. Then it also describes a matter that needs to be investigated in order to improve the situation at hand. As we try to formulate one, you have to ask yourself, is your research problem an important problem? Because not all problems are what? Important. Yeah, sometimes you may go to ask maybe patients, some of the problems maybe they are experiencing as they go to seek for what? Medical services, and someone will tell you, maybe they are always hungry, you get. So like basically there are quite a number of what? Problems, and you have to focus on the important what? Problems. This can be determined by giving a reason as to why the identified problem should be solved. And now escape. You read for us that problem statement. Yes, sir.
Problem statement, efficient management.
Efficient patient management.
Efficient patient management.
When we are doing the research, there are some, okay, like almost each and every terminology you use in your work matters. Like what we were trying to prove last week here. Not all maybe topics may mean similar what, but whatever you put in your topic should make sense. Now, when you say efficient patient management is essential, when you use the word efficient, meaning like this is timely management of patients' needs. Like it solves delay. When you come up with an efficient kind of system, there's a difference between effectiveness and efficiency. Efficiency is usually measured in terms of what? Time, and then effectiveness is measured in terms of what? In terms of what? Achievement. Can it achieve what it is intended to do so? Sometimes, okay, you can have a system which is effective but not efficient. That is what used to happen with ATMs, whereby you go to withdraw money, but you spend like 5 minutes. And indeed, you actually withdraw, but you have spent a lot of what? Time waiting for just a small what? Transaction. But then this attribute, meaning that now, the moment you say efficient patient management is essential, you know, that the timely management of your patients is very, very what? Important. Proceed. Like now, the delivery of quality healthcare can be measured in terms of what? The speed you use to do what? To serve them. However,
because people, patients continue to experience significant challenges in accessing timely medical care. Many patients travel long distances to the hospital with the expectation of receiving treatment but are often turned away due to unavailability of doctors.
So you realize that, okay, people maybe travel longer distances only to be disappointed that maybe, the gynecologist that you had come to see is not available today. You get it? Meaning that now there is going to be a delay in the service delivery. So this challenge is existing.
Those who find doctors available frequently face excessive congestion and long waiting times, which negatively affect patient satisfaction and overall health outcomes.
Yes. Now you see, like there is, okay. It is not only one challenge that the patients are going through, but also those that find the doctors, they realize that the numbers are overwhelming. Sometimes, just imagine maybe you have an emergency, maybe it has been an accident, and then maybe you have now very many people in the queue waiting. So you realize that now maybe someone's, okay, maybe to ask. I'm not so sure, but if I'm to be corrected, what is the major cause of death during the process of giving birth? What usually causes death for people who give birth? Hmm? Maybe my question was not clear. Okay, those people who die while giving birth, what is that major contributing factor to their death? This one does not have even a girlfriend, but is busy discussing issues of giving birth. And what is wrong with you? You're confusing the entire class. Eh? What usually actually causes that? During, I'm saying during, not before, not the pre. I mean, but we are looking at the post. Yes. You say that I have heard about. What is wrong with you? When you say that I have encountered, you're scaring the people. It is okay, it is okay.
So when they put in and realize, I think like I find blood comes in, so when the blood flow is too much, they lose a bit of blood and they end at times they die. Then the other reason is when the child comes out,
No, you can stop. You can stop. Good enough, but that is the perfect submission. These people usually die as a result of losing a lot of blood. So now, meaning that if they are given maybe timely attention, chances of saving their lives is high, as compared to like maybe if someone is put somewhere, you have to wait maybe for the blood group that matches yours, or sometimes like there is only one person working on maybe 5 patients. So you realize that the delay in delivering health service care is usually a very big problem you get. So thank you so much. That is on timely. Fine. Like additionally, those who find doctors available frequently face excessive congestion and long waiting times, which negatively affect patient satisfaction and overall healthcare what? Outcomes. Very good. We are stating the what? The problem. We are in problem statement. So we are just stating the problems that are actually happening. Continue.
Despite the proven effectiveness of treatment appointment systems, improved scheduling, reducing waiting times, and managing patient flow in other healthcare settings, such systems appear to be either and they deny or effective at the point of care.
Okay. Now you realize that there is evidence that once you have patient, maybe it is called patient appointments booking, like it will come with a number of solutions in timely delivery of what? Healthcare services. But now the case study we are trying to point out, these or such systems is either unavailable or underutilized. Proceed.
This indicates a gap between existing technological solutions and their practical implementation, addressing real-world challenges lead the hospital. The persistence of these challenges raises concerns about the efficiency of current patient scheduling and service delivery. If not addressed, these issues may contribute to delay treatment, patient satisfaction, and potential deterioration of health conditions among patients who fail to receive any treatment.
Okay. Thank you so much. If you are among the team that has been assigned to formulate a topic for such research, what would be that particular topic that best suits this particular research? Given the background we have gone through as well as the problem statement, what would be the best research topic that can best suit this particular investigation? Putting into consideration the solution domain, that is now the advantages it comes with, the scope, what exactly is it trying to do to achieve? So what would be the best solution? Just suggest based on what we have been going through. Gishan, give it a try.
But to me, I think maybe coming up with the next thing application because let's say for example, we don't even make appointments and book in regular appointments, not the schedule of the doctor. When we remote medical patients to make it
So the topic would be?
Would be a difficult solution.
The topic. Yeah.
Maybe could be the patient might be else would be there.
Come again?
Healthcare services.
Okay. Thank you for trying. Joshua? Assessing? Okay. Now, thank you so much. In scientific research, we don't use the terminologies like assessments. Because for us, we are not just there to do what? Yeah, but we are actually providing a tangible what? Solution. So meaning that we can omit that word, which assessment, and then it remains. What would be a working one? Yes, please. Okay. You rephrase now the entire topic.
Optimizing optimizing appointments with patients.
Okay. That is so good. I actually like so much when you use the word when you use optimization, because the optimization usually is aimed at doing what? Speeding up futures within what? Systems. So now, when you say optimization of maybe patients' appointments, systems, you can call it booking, you can call it anything, as long as there is that element of what? Speed or time. So that is why we have been using the word timely. So efficiency can work, optimization can work, faster can also work, and then you can end with the system, meaning that you are coming up with a system that achieves the first terminology, either optimization, efficiency, and so on. Next. Okay. Members, on slide number 11, I don't know if it is really 11 on yours, but we are on a slide that has the title, problem statement in brackets, or problem definition. Very good, that one. Not all problems are researchable problems. If there is an indication that investigations of a given situation will improve the situation at hand, then this indicates a researchable problem. Is there something that you can think about which is not researchable? Not all problems, actually, there are problems that are actually happening, but we don't have solutions for them. Like in the domain of IT. Okay, let me just give you a very simple question. How do you rate security in Google services? We all believe and agree Google is a very prominent, well-tested, strong entity, right? With the various what? Services. But how would you rate their security? Have you done a course unit called information security? Yes, that is where we are now. So what would be the percentage for Google or Microsoft security services? Anyone? Yes. 80%? Okay. Okay. Now, okay. Thanks, Joshua, for the submission. Though you underrated the guys, if they hear you rating them up to that lower level. Anyway, Google's security is usually 99.9 what? Percent. But as you know, in security, okay, in IT, security has never been 100% what? Perfect. It has never existed. And it is not so happening. Now, meaning that if you attempt to come up with a system that will fully maximize security in banking systems, then that is a lie. Security in IT has never been 100% what? Perfect. And it is not easy. Is there anything else you can think about that is not solvable using IT? Anything that you can think about, but it is a bit hard to do what? To solve using tech. Yes, please. Don't start. I know where you're going. Now you want us to start discussing about corruption until tomorrow. We shall not take that route. Okay, anyway, thanks, but be more specific. Because really, no, this is something that can be solved, but when I say be more specific, because when you say corruption, that may seem to be very what? Broad, eh? Yeah, because okay, maybe let me give a very good example to rule out your submission. When you apply for visas, you always got to attend what? Interviews, right? At the embassy. Now, during COVID, where people could not walk in, physically, embassies like Canadian embassy decided to now transform their physical paperwork into digital form, whereby now you don't meet any single what? Person. And actually, you even don't know the person who handles your what? Your application. So meaning that the moment you draw with the man-to-man what? Interaction, then you can draw with what? Corruption. Corruption, if there is a will, like we have said before, there are quite a number of ways to do what? To fight it. Yeah? Technology can simplify this very fast. But is there something else that you think is hard to achieve using tech? Yes, please. Okay, very good. A very good one. That you cannot come up with a system that is going to prolong, to avoid, or to stop death. You cannot. You can't avoid death. Okay, you can't have a system that can completely, use the word completely, avoid what? Death. Thank you so much. Okay. Are you sure we don't have some? We don't have some? Okay. Thank you so much. Let's go to the next slide. I must have included some. Okay. We have what we call the artificial general intelligence. You see, AI has taken over almost each and everything, but it cannot take over like everything. Like now, when you go to certain company that embraces AI, it will have all the solutions. Usually, it has specific solutions that does the prediction and it provides solutions, but we cannot have what we call the artificial general intelligence in place that handles each and everything. The same, I mean, the one that you can use for maybe treatment is the same that is used even in transport, the same that is used even in education, same that is used in, agriculture. So it is a bit hard to have such what systems, but also creating a computer that can think and feel like a human being. That even when you go and you pierce, the computer can feel what? Pain. So there are things, there are innovations which are really unsolvable. And then designing an AI that perfectly predicts human behavior. That the moment you walk in like this, you know, then it will detect this one is a thief according to those looks and walks. You get it? There are people who actually walk like thieves when they are indeed what? Innocent. You get it? Now it becomes a little bit hard for machine, for an AI really to do what? Now to start predicting such. And building a system that fully replaces human decision making in all fields. That yes, you will use it in accounting and it gives you perfect decisions. Then when it comes to now your sleeping maybe pattern, then it also provides you the solution. When it comes to maybe, you know, a grade, medicine, I mean, it cannot. Then having like a programming language with zero limitations is also not easy, as well as creating software that automatically fixes all its own errors perfectly. I've not seen one before, as well as creating a system that can predict and stop all future cyber attacks. It is a little bit challenging that, okay, I can have one which will tell that maybe in 2030, we might have hackers who use such and such, and for that matter, they will be captured using this and this. Becomes a little bit what? So not all problems are what? Are solvable. Yes, there are things that we shall not spend much time on because the solutions are not what? Easy to get. Go to the next slide. We have go to the next slide. No. Sources of research problem. Is it what you have? Sources of research problems. Okay. We have, haven't we discussed this before? Yeah. You can get from published work, reflection on the experience of professionals. We have done this. Next. Okay. A research question is the question that you are trying to answer when you do research in a given area. Let's look at an example. How can a transaction information system be developed to improve daily operations of Nkozi Hospital? What features, properties can be used in the development of a traffic monitoring system? So you can use the 5WH to ask various questions that can help you to formulate your research Your research solution domain. Thanks. Each and every research must have a target. I'm doing ABCD to achieve F or P depending. So that is the objective. The research aim. If you don't call it research aim, you can call it a research goal. If you don't call it research goal, you can call it research objective. Usually the main objective. If or when you talk about a research objective, the main objective clearly explains what you are going to research about and what you intend to solve. What you're going to research about and what you're going to solve. That is why we can have topics and the examples like developing an AI that registers farmers within a certain district. So meaning that now for you are just focusing on the use of AI on farmer registration, only that. That is your main what? Objective. Yeah. So look at this example. To develop a transaction information system to improve daily operations of Nkozi Hospital. 2, to investigate the features, properties that may be used in the development of traffic monitoring system. So you realize that your research objective is always derived from your research questions. So the research aim should be decomposed into specific research objectives. Like I told you, each and every main objective must have what we call specific objectives. Now, these specific objectives are the ones that actually contribute to the attainment of the main what? Objective. If you want to design, you want to develop appointment booking system for Nkozi Hospital patients, that means you have some things that you have to work on for you to achieve that. One can be, if we are to achieve the development of appointment booking for Nkozi Hospital patients, that being our main objective. What are those things that we need to work on for us to achieve that, so that they can become our specific objectives? Give it a try. Okay, but not really. If we are to come up with one, we can use any language as long as we can do it. So that may not be one of the specific ones. Okay. Now you are nearing. That is okay. Joshua says we need to make it in a way that is user-friendly, so that okay, that is 50%, right? Yes, English.
The first thing is to first identify who are with the system.
Okay, that is good.
And the second, as we said, you know that system is ensure that is inclusivity, whereby the system can be better for both the blind, no. Then it should be able to be put user interface.
Okay. Okay. So you're saying understanding the nature of patients is very important, because not all patients who actually go to book appointments are what? Maybe can read and see. So you're saying that we can also now cater for, but then that would come in if we are working on a special needs solution for that hospital patients. You know, the people who are called the special needs, people in that category. So now, yes, we can even now, you see, research is endless. That is why it is actually called the research. Now, you see, you can go to a hospital that already has an appointments booking system. But now for you realize there is a research gap, because someone who is blind cannot use such a word. Now then for you decide to convert this into, how do you call, okay, we are looking at catering for the blind, right? But I don't know what technology can we use. What I don't understand well their technologies. Actually, very good. Now at least I'm picking something.
Yeah, I recommend my person. But that person I made also in as a mind. So she wanted assistance from me. That was the plan.
Yes.
So like when this phone are being drawn, there are those videos that are those videos students.
Okay.
Where like for example, if whenever you are done that teacher, you enable the other person, you really plan for maybe any kind of maybe disability or impairment. So when I click on that, when you send me a message, if you automatically display it when you just
Okay. And I think you can take it a very simple way whereby instead of coming and then probably maybe you type in, you register, blah, blah, can't we make it voice, recognition whereby, yes, when I speak, the system will respond. I get to know if they are available what slots on that particular day, maybe for a particular specialist. This can be a dentist, it can be a what, and then I book one. I can confirm, yes, I'm coming, and then that can be registered. Okay, thank you so much for that contribution. Okay, yeah, now for that kind of system, then we shall have to really confirm if the case study where we want to implement this system has such what? Category of what? Patients. Because it will not make sense for us now to take such a system to a place where there are no special needs users of that particular what? Maybe category. So, anyway, now for the specific objectives, usually we come up with the specific objectives. Okay, before we come to specific objectives, the main objective should be in line with your topic. If your topic is in what? In what? Content creation. Okay, very good. Let us just take it like that. AI in content creation, or the use of AI in content creation, or AI whatever. Now, if we say AI in content creation, we can now make our objective to be, the main objective, to develop an AI system that helps maybe certain group of users, doctors in content creation or social media handlers in content creation, something. But you see that we are looking at our topic, and then that is what we want to achieve. You get it? Yeah? The development, or to develop an AI solution that can be used in content creation in secondary schools, content creation in media industries, content creation somewhere. Just I'm doing that just to be more specific, not to leave it content creation, I don't know which type of content and where, but to be more specific. That is very good. Yeah. So for that matter, then when we talk about the specific objectives, then we shall look at areas like assessing the need for content creation, then talk about we can talk about things like designing a system that can allow AI integration into content creation until we reach the test and develop. Usually we can list our specific objectives in the form of system development life cycle. If you have to come up with a system, then you have to follow the SDLC as you propose. As you propose what? Your specific objectives. We can start with the analyzing the existing system being used at the hospital. Number two, we can say to design, a system. Then after we can develop, then we can test, and so on. Test and validate. Those becomes your what? Your specific objectives. Next. Okay, smart research objectives. Like your research objectives must be smart, meaning that they should be specific, measurable, achievable, and relevant. When we say specific, what do you want to do or to achieve? Measurable, how will you measure or determine whether you have achieved the objective or not? Then achievable, given the resources you have. Like, that is why I said one time, we shouldn't come up with something very broad. That is why we have that section for scope. Now, when you talk about appointments booking, focus only on what? Appointments booking. Don't go into issues of billing, issues of maybe stock taking, and so on. You are only focusing on what? Appointments booking, meaning that even when it comes to the users within your system, you're going to have only the patients and the people they are looking to book, who are the doctors. So you are trying to do what? Do something small, relevant. Will the set objectives lead to the desired end result? But also the time element should be very, very what? Important, time bound. When will these objectives be achieved? Next, if you want to come up with a smart research objective, you follow the following. SDLC. You first analyze requirements. Try to understand what do users need for them to work on this particular system. Once you have your requirements, you analyze them. Then after analyzing these requirements, then we can now go to design. After designing, then we can now start the development. If you don't call it development, you can call it implementation. If you don't call it implementation, you can call it construction, depending. Then once the development is done, then you can proceed to test and validate. Yes, then that means you will have your smart research objectives. That is according to Kendall and Kendall 2010. Then, when you are formulating, whatever we are talking about right now is what you need as you're coming up with your either your concept paper as well as the proposal. Now, among the sections which should also be included is what we call the research scope. I told you that research scope is a clear definition of the boundaries of or the limits of your investigations. Like we have just said, limit, yeah, so that you get to know which users am I going to concentrate on. Actually, when it comes to final year projects, there is a time where you have to come and present your work, you defend your work. Now, someone can even ask you, how comes we are saying that your appointments booking system does not have a section where people can be charged or like billing? So you mean maybe hospitals are going to treat people for free or something, but now you always base your defense on the scope that I only catered for what? Only booking for appointments, full stop. I never went ahead to do it. Then that can be included in the future research. Yeah, because every research has that section for future work. So these boundaries must be defined because there is often not enough time and resources to complete all ideas related to the research problem. This goes back to coming up with systems. Okay. When we are coming up with systems, we have what we call measures of successful work systems. We have to measure the real indicators. How do you confirm, how do you measure that your system has been what? Successful one? It must have been attained on time, within budget and within quality, right? But remember, the user needs keep doing what? Changing. So now the question comes, if we receive new changes, can we integrate them into our what? Our system? And for methodologies like Agile, you realize that it advocates for changes, meaning that you can allow changes so long as these changes are not going to affect the time you're going to spend on the project, the cost, or even divert away from the quality. Then those are what? A good kind of changes to accommodate. So research scope can be categorized into two, where we have the geographical scope and the theoretical scope. Geographical scope, that is now, for example, your case study, that you're going to concentrate only and only at Coast Hospital, not any other one facility. Then when we talk about theoretical scope, like which theories are you going to use as you come up with your research? There are theories. For example, in technology, we have what we call the diffusion of innovation theory. And then we have also what we call the technology acceptance model by Davis. Now, those two theories, they are all for innovation adoption, but they differ in a way that for Davis's term, it only looks and concentrates on usefulness and usability of the system. It does not look at other things. That if you want people to adopt your system, you should make it easy to use, ease of use, and then it should have the meaning as to why they should use it, that is usefulness. Yet the other diffusion innovation theory of another person talks about other factors. Then you read through those theories, I mean the theoretical scope. Then we go to the next one that talks about significance. You can call this significance or justification. Now, I just want to let you know that justification means, was your research worth undertaking? It is like the way how you can go maybe to Karamoja, and maybe you start saying, okay, do we have someone coming from Karamoja here? Or they are in practice for tomorrow's event? Are you sure? With that height? Anyway, okay. I think we should drop issues of culture in explanations. Since we have someone who can catch us, let us leave with that. But basically, when you want to come up with a proper justification, it is a matter of proving that indeed this research is what? Worth conducting. It is. So this refers to the relevance of the study in terms of academic contributions or practical or industrial use. If, for example, we don't come up with the proper traffic AI traffic control system, then we are going to continue having traffic within what? The cities. Because people are continuing to buy more cars. So yet the existing system cannot do what? Manage the big amount of what? Vehicles within the city. Why is your study important? Which literature can you find So we can justify and prove this by bringing out literature. But so and so said, this problem is existing. Another scholar also confirmed that there is this particular problem. Like, so you can justify your study by bringing supporting what? Articles. Yeah, that it confirms that that particular problem does what? Exists. And maybe some that also confirms that if this problem persists, then we shall have negative what? Impact within the society. If we don't handle or implement the four-factor authentication, then people are going to continue. Probably hacking into people's accounts, transferring the money, and so on. So basically, you bring out those journals, publications that support as to why you have to carry out your research. And also now you indicate who will benefit from your research results and how they benefit. Go to the next one about research topic. Yes, please. Before you conduct research, everything we are doing here is before. Yeah, if really there are no supporting evidence, then there is no need for you to go in research. Yeah, then for research topic, a clear statement that represents the aim of your research and result of your research. It is important to first define a problem statement and research aim prior to formulating even your topic. That is why in the third year, when you are assigned supervisors, you see, even on the last day, even on your last day of defending your work, your topic can change. Depending on what you present and how you present it. If you say an effective traffic control system within Kampala, you're using the word effective, meaning that it should prove the effectiveness. If you say an efficient blood testing kit system, meaning that it should show the efficiency in this particular what kit you are trying to do what to bring on board. Okay, the systems maybe we have been having could take maybe 5 minutes for someone to have their what results. Now you're saying you are coming up with an efficient one. And it produce results after 2 minutes. So if it does not, then the system, the topic can do what? Can change. So that is why it is always good that you understand the problem and then your solution domain. So a research topic can be derived from a research aim or a research question or even your problem definition. Now let's go direct to the concept paper. First, scroll through. Okay, we have just a few slides. I think like 5 to finish. Now, when we talk about the concept paper, just to know, it is a summary or a brief what? Kind of research that you are trying to do what? To come up with. So a concept paper is a summarizing description of your research background, the problem statement, research questions, and so on. It can be viewed as output of phase 1 of the research process. The acceptable length of a concept paper is usually 2 to 5 pages, including even what? References. Like, okay, like generally you summarize what would be in your background, the problem statement, objectives, like it is just a brief of the general picture. Yeah, typically the concept paper evolves into a research proposal, which covers the contents in greater depth. That is the format on the next slide. The format of a concept paper, where we have it starts with a research title or topic. Then you will have your introduction. Now, within introduction is when you bring in the background, the problem, your problem statement, as well as the objectives. And then we shall go to the research scope, the significance, the methodology, as well as we end this with what? References. We have the research plan, then the steps in designing the research plan, as well as the example of a research what? The research plan. And that marks the end of our